everybody, and welcome to another episode of Fun Facts at the Pharmacy. I am your host, Dr. Grider. The beginning of our show, we like to do a little segment called Fast Acting. The purpose of this is just to kind of give you guys a little bit of info about current things that are happening in the healthcare field. The first thing that we wanted to talk about, since it is the month of May, it is actually Stroke Awareness Month. So a lot of people don't realize how important that is. Stroke is actually the third leading cause of death in the United States. So for a lot of people, they don't realize what's happening until a stroke actually occurs or they have a heart attack. Now, the main thing that I want everybody to be aware of is this is why I kind of stress the importance of getting physical checkups done and taking a look at your family history with medical conditions. The biggest thing right now with stroke is if you do have a family history of it, there's a very high chance that you would be susceptible to it. So the main thing we want to do is if you know of anybody in your family or if anybody closely related, so we're talking mothers, fathers, grandparents, any of that, that's what we're concerned about, because if they've ever had a stroke, there is a high chance for you to as well. Diet also plays a big role in it, and this is something that we will cover more in depth in a future episode of Fun Facts at the Pharmacy. But the main thing for right now is for this month, if you know you have a family history and you've never gotten checked out for it, it's not a bad idea to get everything checked out, because high blood pressure, diabetes, these are all contributors that can actually lead to potential strokes in your future. The other thing that we wanted to cover today for you is there is a new vaccination that's out on the market. Here at the show, I'm a strong promoter for vaccine use, but there is one for shingles, essentially. So a lot of people don't know what shingles are until something happens. Well, shingles is essentially, if you've ever had the chickenpox as a child, you're very prone to actually getting it because you have the virus already inside of your body. I know myself, I actually did when I was younger, and most people around my age have as well. The main thing with this new vaccine called Shingrix is it's actually used to treat shingles. The nice thing about it is that it's actually not a live active vaccine as you'll sometimes hear. It's actually an inactivated vaccine, which means a lot of people that have compromised immune systems from different things such as HIV and AIDS would be able to get this type of vaccine just because it actually wouldn't cause the virus to run rampant and cause any problems to potentially cause shingles. It has been found to be 90% effective right now, so even if you've already had a shingles vaccine done, which is typically the Zostavax, they actually recommend still getting the Shingrix, and it is available at most pharmacies without a prescription. So if you are interested in that, please talk to your doctor or your healthcare provider, whether that's a pharmacist or nurse, and we can definitely guide you in the right direction to figure out if this would be appropriate for you and when you should get it. Right now, it is indicated for anybody that's over the age of 50. So most people are typically prone to being hit by it when you're older than the age of 50. And most people that typically deal with shingles, it normally occurs around that time frame for you. So if you ever had the chickenpox and you have any questions about it, please make sure you're talking to your doctor or your pharmacist about it, and we can definitely guide you in the right direction. For today's episode, we're actually going to talk about something interesting. So with the nice weather coming out and people are going out and trying to have picnics and, go to barbecues, things like that, the most common thing that I get asked about with stuff like that is something about heartburn. So essentially for heartburn, and there's other diseases that go with it, especially one that you'll sometimes hear called acid reflux, there are different treatments that are available over the counter. But to kind of help guide me with this one, I actually have a student with me today who's going to help kind of guide us in regards to how to go about treating that and what you can do to kind of help that. So with me today, I have Kelsey here. Go ahead and say hi.
Hi, thanks for having me, Chris. I appreciate it.
Yeah. So Kelsey, just kind of touching the basis of everything. Most people typically know a little bit of what heartburn is or what acid reflux is, but medically speaking, what are we talking about here?
So medically speaking, heartburn is when the sphincter from the esophagus to the stomach, or the little hole that opens up the food pipe, you could say, to the stomach, that is a little bit looser or opens up and allows the stomach acid to flow up into your esophagus and cause that burning feeling. Now, some people may feel it in their chest, but it can also radiate to their back, up to their jaw and neck.
Okay. So it can cause a little bit of an issue all around the body, essentially, in that
Yes.
upper part. Okay. Yeah. So in regards to actual dealing with acid reflux and things like that, some people have actually come into my pharmacy and they've asked me, oh, are there any foods that I should avoid, or are there any problems that I should? So talking about just kind of in regards to dietary purposes, what are some things that you would tell people to be concerned about?
So there are quite a few dietary issues and foods, beverages that can either cause heartburn or make it worse for some people. The main one that we think about is spicy food. It absolutely can cause or aggravate heartburn for a lot of people. I know a lot of people enjoy spicy food, but trying to avoid that is one of the major things that can help get rid of that heartburn for you. But there are actually a lot of other common foods out there that will cause heartburn. One of them being caffeine or coffee products. Alcohol and soda and carbonated beverages, those are in your drink categories. Those can all cause heartburn. Some other foods that can cause that would either be citrus fruits, such as lemons, oranges, pineapple, and then you also have mint and tomato. So a lot of people who eat spaghetti sauce all the time, that can be a major trigger for heartburn.
Okay. So you're telling me I should just avoid essentially the pizza and Sprite, mixing it all together and just chugging it down?
I'm not saying to avoid it, but if it's causing heartburn, I would avoid it.
All right. So when we're talking about the effects of heartburn, I mean, a lot of people don't understand like the long term. They only feel those temporary things where you have the, the belching that can occur and some kind of like, pain in your chest that can radiate. But what are some of like the long term effects if you let this just go out of control?
So if you let it go out of control, it can lead to an ulcer in your stomach. It can also lead to erosion or a wearing and tearing of your esophagus. Those are the two major things that come to mind when you're thinking of long-term effects of heartburn.
Yeah, and the other thing that we're always concerned about is when you start doing a lot of that tearing away, especially in your esophagus, it can, not to scare anybody, but it can potentially in the long term, when we're talking years, cause cancer to essentially occur in that
Yes.
area. So just to kind of be on the safe side, we want to make sure that we're hitting this as soon as possible to kind of prevent any of that wear and tear. So perfect.
Exactly.
In regards to, treatment purposes, I mean, we're talking, there's like a number of things that people can always talk about. Even doctors have mentioned it time and time again. But in regards to just dietary day-to-day things, what are some things that people could actually do to kind of help cut that down a little bit?
So to help get rid of heartburn without medication or medical treatment, the first thing you can do is avoid those food triggers that are known to cause heartburn. So again, the spicy foods, tomatoes, soda, caffeine, alcohol, all of those. That would be the first step to take. The next step would be to eat smaller meals. If you're eating smaller meals, your stomach's producing less acid, so it's causing less irritation in your stomach as well. Okay. So some other things you can do are weight loss. You can quit or reduce smoking, which I know you had an episode on smoking cessation. Mm-hmm. So if anyone out there has any questions on smoking cessation, they can refer back to that episode. Mm-hmm. And some people who have nocturnal symptoms or bedtime symptoms, they can avoid eating 3 hours before bed or using something called a GERD pillow, which elevates the body 6 to 8 inches at nighttime and lets gravity use its force to keep the acid down from the stomach.
Okay. So yeah, just kind of taking a look at it, there's a lot of things that people can do there just to kind of cut back on it. And the other thing too is sometimes even if they can't afford something like a GERD pillow, even putting blocks underneath their beds, that can also elevate it that same 6 to 8 inches. So that would be something else that some people can do there for them. Mm-hmm. Are there any potential medications that people should be avoiding as well? Because I know dietary, there's a lot of things that we just mentioned, but in regards to medicines, there are certain medicines that can do that. So what are some things that people should look out for?
Yeah, so there's a large list of medications that can cause heartburn or upset stomach, but some over-the-counter products that people don't think of would be NSAIDs or non-steroidal anti-inflammatory medications. Those include ibuprofen, Aleve, Motrin, those medications, along with aspirin as well. Some other supplements such as potassium or iron pills can cause the heartburn as well. But when we're speaking for prescription medications, we have things like antibiotics, osteoporosis pills like Fosamax or Boniva. And then we also have opioid analgesics, so your Percocet, Norco, morphine, and also chemotherapy medications.
Perfect. Yeah. The main thing is, especially when we're talking about the medications and when you're talking about especially supplements, because that's the most common thing I see a lot of people just coming up and grabbing. When you're talking about the potassium and the iron, you get the best absorption with that stuff if you take it without food, but kind of like an alternative around that is if it bothers your stomach or causes a lot of that reflux, you can always take it with food.
Exactly.
You won't get the best absorption with it, but it'll help out ultimately.
Yeah. You have to weigh the pros and cons of it.
Exactly. So, yeah. So when we're talking about treatment purposes, I mean, what is our ultimate goal with heartburn or acid reflux? What are we trying to do?
So our ultimate goals are to provide symptom relief, prevent recurrence of heartburn, and to prevent unwanted effects of medications that you could take for heartburn.
Okay. So, yep. With lifestyles, I mean, we're talking, this is also falls into that, we don't have to take medicines to help treat it. What are some things that we're looking at for lifestyle changes?
So I already mentioned losing weight or quit or reducing smoking as one way to prevent heartburn or to help lower your risk of heartburn. So that's one way. Another way would be to reduce the stress in your life. Stress is a major cause of heartburn. It can cause people to feel nauseous and just overall call off of work sometimes. So it's the major thing to do is reduce stress. Another thing would be to not wear tight-fitting clothes. As silly as that sounds, wearing a tight belt or tight pants or anything like that can really squeeze on the stomach and cause that acid to push up into your throat. And then the last one would be laying on your back for excessive amounts of time. That's also letting gravity do work, and if you're laying flat, then the acid can just float back into your esophagus, and we want to prevent that. Gotcha.
Yeah, even though people look better in tighter fitting clothing sometimes, yeah, we do want to avoid that, especially if you're dealing with these symptoms. So.
Exactly.
So kind of just jumping in then at that point to more of, I guess, the treatment basis. I mean, there's a lot of choices that are available over the counter. There are some that are behind the counter as well. So when we're talking over the counter right now, things that people can just go and grab, what are we looking at?
So there are many, many products on the market for heartburn. A lot of them are advertised on TV saying, pick me, use me first, but really there are a lot of things to consider before taking heartburn medication. And I like to break down the over-the-counter heartburn medication into 3 classes. So there's your antacids, and then we have your histamine blockers, and then your proton pump inhibitors. So the first one I like to go to is the antacids. So you may know these as Rolaids, Tums, Mylanta, Gaviscon, Pepto-Bismol. Those are the brand names that you may hear, and you can see the shelves loaded up with those names. But really there's a few active ingredients that are listed on the back of the package. So there's fewer active ingredients than there are brand names, so really brands are just jumping back and forth to what the actual product is that they're using. And some of those are calcium carbonate, sodium bicarbonate, aluminum or magnesium hydroxide, or bismuth subsalicylate. So I know that's a big tongue twister of names out there, but those are the major ones you're going to see on the back of the packages listed under active ingredients. And with the antacids, they are very fast acting. They'll work within less than 5 minutes. I've heard anywhere from 30 seconds depending on who's speaking about it. But they can work in less than 5 minutes, and they only last about 20 to 30 minutes. So they're for immediate relief. A lot of people don't understand how they work. They just know it works right away, but the way it works is those calcium carbonate and sodium bicarbonate, those combinations split up and bind with the acid to create water and to help neutralize the acid in the stomach. So that's how it works.
Yeah. So simply just even talking about the antacids, one of the big ones that I normally come across is Pepto-Bismol. A lot of people swear up and down by Pepto-Bismol. Now, the biggest concern that we have with Pepto-Bismol, and a lot of people don't realize it, is it actually has an ingredient that's similar to aspirin. So our big concern with that one, and this is essentially, we'll jump into this a little bit later about who would be excluded, but if you are looking for treatment purposes, the one thing we want to make sure people are aware of is if you have a high bleeding risk, or you've had a history of ulcers, or if you're under the age of 12, make sure that you're not using Pepto-Bismol because it has that potential to work just like aspirin, and it carries all the side effects and risks that are associated to it.
Exactly. That was going to be one of my points to make is when you're picking out these products, a lot of them are in combination with other medications like aspirin, Tylenol, NSAIDs, anything like that. So it's always important to check the back of the package, see what active ingredients are there, and make sure you are able to take those medications, or if you're not taking them in another product. And the best way to, if you're unsure, to figure out if you can take them is ask your pharmacist.
Exactly. Yep. If you have any doubts about the ingredients, that's the best place to look at because that's what we're here for. So,
yes.
The other thing too that I think some people need to understand is in regards to using the antacids, they work very well. But if they're not cutting the job, be careful as to how frequently you take them. they do have a notorious habit of kind of backing people up, so to
Yes.
speak. So it can it can actually cause a little bit of an issue in that regard. So we always want to be careful with how long people are using that stuff for. So
Exactly.
yeah. So kind of jumping into that next class, because I know you mentioned there's about 3 classes. So the next one after antacids we're looking at are those histamine blockers.
Yeah.
So
Histamine blockers, or H2 blockers, as we like to call them, they are known as your Pepcid, Zantac, or Tagamet, and there's only 3 active ingredients that are on those products. So you're looking at famotidine, ranitidine, or cimetidine, and that's what you can get over the counter for your H2 blockers. These work by suppressing the acid release when your stomach is stimulated to release it by when food hits it.
okay. Yeah.
Yeah, so these take a little bit longer to work than your antacids do. They'll take about 30 to 60 minutes to work, and they'll last about 4 to 10 hours, so they're okay for immediate relief, depending on how immediate you need it. But they're great if you know you're about to eat food that triggers it, such as spicy food. So if you know you're going to eat that, take it 30 to 60 minutes before your meal, and that should help suppress the acid.
Yeah. Are there any concerns or issues that we ever have with any of those medicines?
Yeah, so one of them, Tagamet or cimetidine, that one we need to be very careful about. There are many drug interactions with that, so including over-the-counter products and prescription products. So it's always safe to talk to your pharmacist or doctor before taking Tagamet, or you can just jump right to Zantac or Pepcid and skip the risk of drug interactions.
Yeah. Perfect. And that's the main thing. Even when I was going through school, now this is granted my own personal opinion, but we've always said that Tagamet was essentially, that we equate it to the devil, so to speak, because
Yes.
it causes such a problem. So
Exactly.
yeah, if you are using that one, please make sure that you're verifying all your medications with your pharmacist and make sure that there's no problems there. Yeah. So kind of jumping in then into the next class, there's one
Yeah.
other one. So what are we talking about
So
here?
the next class are proton pump inhibitors, or PPIs, as we like to say for short. And those are your Nexium, Prilosec, and oh my goodness, I'm already forgetting names, Prevacid. So the active ingredients in those are esomeprazole, omeprazole, and lansoprazole. And these medications are not for immediate use. They are for long-term use. So if you're having heartburn greater than 2 days a week, this would be more of the medication for you. It takes 2 to 3 hours to work, and it'll last 12 to 24 hours. It works by blocking acid release from the stomach and the cells that produce it. So you're overall just stopping acid production, and it works in the long term that way.
Okay. With those medications, like you said, they do work for a much longer period of time. When we're talking about concerns, I know there's been a lot of research that's been done lately, kind of looking into, especially like Prilosec and Nexium right now. So are there any concerns that we ever have for patients on these?
Yeah, so there's quite a few concerns. The first thing I want to start out with is you can only use this product over the counter for 2 weeks worth of time, and only every 4 months. If you're using it more frequently than that, then you need to see your doctor and get advice from them. The next thing is that there's been quite a few studies that have come out in the past couple of years regarding long-term effects of use of these medications. The first one being Clostridium difficile infections. It's also known as C. diff, or the diarrhea infection. And with this infection, it happens on these medications because the spore of the bacteria, it doesn't get broken up by the stomach acid because there's not as much in your stomach if you're using these products. So you're increasing your risk of infection that way. The next study that has been coming out is an increased risk of bone fractures in patients over 50 years old. It's because you're not getting as much absorption with your essential nutrients and vitamins. So with that, it's important to supplement that or be monitored by your doctor for these levels. The next one would be vitamin B12 deficiency. Yes, that can be replaced over the counter, with another vitamin, but it's costly to do so, and you want to prevent any additional medications if possible. And then the last one that's come out more recently is it does increase your risk of dementia and chronic kidney disease. So it's very important, again, if you're on these long terms, to seek advice from your doctor and make sure that you are okay to continue taking these or to start taking them.
Yeah. And that's brings up a really good point, which is these all have recommendations. So whenever you're using anything over the counter, make sure you're reading the directions and the warnings that are attached there. For these particular medications, most people are always trying to go longer than the 2 weeks without checking with somebody. But like you mentioned, there are a lot of effects that we have to be very careful about. So if you do feel like you need it for longer than 2 weeks, just make sure that you're actually going in and talking to your doctor just to make sure that they're on board and aware of what's going on with that. In regards to just kind of comparing it, a lot of these agents are typically available behind the counter as well. So we do them as a prescription as well. Are there any major differences that you see between the prescription versus the over-the-counters?
There's only a couple things I can think of when it comes to the differences between over-the-counter and prescriptions. The first one would be the dose of the medications. A lot of the over-the-counter products are a lower dose than the prescription products. Doesn't mean you can't get the lower doses as a prescription. The next thing would be insurance coverage. If you have a prescription for it, your insurance may cover it. It all depends on your plan, so that's something you would have to find out. So that may be a little bit more cost effective. And the last being that your doctor has a record of you taking that, so does your pharmacist, so they can check for drug interactions and monitor anything that they need to monitor, such as the long-term effects of proton pump inhibitors.
Okay. Perfect. Yeah. So the main thing that we're looking at right now is, we've talked about a lot of different medications. The main thing is with the prescription-based ones, always check your dosing, because I've had a lot of people that come into my pharmacy that'll simply ask, oh, can I just take the over-the-counter? I don't want to go through my insurance or deal with that. So make sure that you're checking your dose out, because there is some differences between there. And if you have any questions or doubts, always check with the pharmacist just to make sure that that's all lining up for you.
Right.
The only other thing I'll say is, we kind of touched on it a little bit, but is there anything that would exclude somebody from treating themselves?
Yeah, so there's quite a few things that would prevent a person from self-treating over the counter, which a lot of people don't realize, but it is something that if you're having these, then you do need to seek medical attention. Some of them not right away and some of them immediately. The first few ones are not as major, but if you're having heartburn longer than 3 months or heartburn while taking over-the-counter treatment, that is a sign that it's not being treated properly and you do need to seek help. The next would be heartburn that continues 2 weeks after completion of treatment. So especially for those proton pump inhibitors, that is something to look out for. Any severe heartburn, anything that's radiating far up into the chest or feel like your chest is being stomped on by an elephant, or nighttime heartburn, that would be something to talk to your doctor about. Mm-hmm. Some of the more alarming signs would be if you're vomiting up anything that looks like coffee grounds, any substance like that, or having dark tarry stool. That could be a sign of an ulcer or a stomach bleed, so that does need immediate medical attention. If you're having continuous nausea, vomiting, diarrhea, mm-hmm. or any chronic hoarseness, wheezing, coughing, choking, unexplained weight loss, those do need medical attention pretty soon. But the last one that would prevent me from recommending something over the counter, and I'd actually call an ambulance for this person, is any chest pain that comes along with sweating, any pain radiating to the arm, neck, jaw, shoulder, and also shortness of breath. Any of those signs could be a sign of a heart attack, so that would need immediate medical attention. I know there are some people out there who have had heartburn that feels like a heart attack, but it's very important to go get that checked out right away to rule out whether it's heartburn or a heart attack.
Yeah, and that's the main thing. We always want to make sure everybody's safe with that. So yeah, the symptoms can line up a little bit, but we want to make sure that if it starts changing, just in the way that Kelsey has explained, we always want to be safe, so make sure that you're seeking medical attention.
Exactly.
Besides that, if you guys have any questions or concerns, make sure that you're talking to your pharmacist or your doctors. They're the people that can really help you out with these. And to find the perfect treatment, always ask questions. That's the one thing that you can do. Just because a commercial tells you, Larry the Cable Guy is telling you to go and use Prilosec, that doesn't mean you should jump immediately to Prilosec. There may be other ways to slowly step up to that if you need to, but we always want to make sure that we're doing the right thing for you. Well, that covers pretty much the entire episode for this time for you guys. We will have some episodes kicking in within the next month here, but for right now, thank you for watching this right now. If you have any questions, make sure you're talking to your pharmacist or your doctor, and until next time.